Hey everyone, welcome back to all my listeners. Now I hope you're all having a great day so far. I know I am. Can you guys believe it's already April? Wow, 2022 is flying by. Now I've had a pretty tough, crazy, and emotionally spent month of March, literally in its entirety, from beginning to the middle through the end. It was a crazy month of emotions for me. So I'm looking forward, in fact, to working on site at the office for this next entire week. And by the way, for those of you who don't know, the office is located in Florida. And the company I work for is located in Florida. So bye-bye cold, wintry mixed stuff, whatever it is that's falling out of my window right now as I'm recording this episode in Chi-Town. Bye-bye. I'll be in Florida for the week. And hey guys, if it's your first time finding me, thanks so much and welcome. Welcome to my 14th episode of Season 5. Today is Wednesday, April 6th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, guys, now I just hinted, right, at my emotionally charged month of March, right? Well, it just happens that I've got a lot to get into today from my special guest, as well as when it comes to my compliance tip today. I want to be talking about emotional and mental well-being. So my compliance tip today is going to let you all know about this new TPE audit for Psychotherapy Services. And as I mentioned, I'm going to be rolling out the carpet once again for a very special return guest who's going to be spotlighting behavioral health services. And that's with my good friend, Jennifer McNamara. And I close out today's episode with some inspirational words on clarity and focus from the American actress Angelica Huston. If you checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, and in compliance and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So let's get into a very special Newsworthy that features my return guest today, Jennifer McNamara. I'm so excited for today's session with you, my friend. Can't believe you're back with me. I'm so happy that you're here. So welcome, my friend.
Thank you so much. I'm so happy to be here.
Love it. All right. Now, you know what? My audience should remember you because you were a favorite guest on back in season 3. So 2 seasons ago, I featured you. So I knew it was time to have you back. So I just wanted to know, I wanted us to catch up together on what's been going on during this incredibly crazy, very lengthy pandemic, right? We've all been through this for the past 2 years of madness. So why don't we catch up?
Absolutely. Well, I will tell you, I honestly firmly had in mind, I was prepared for another year of this because I was thinking, okay, this part of the pandemic is over, but then this other variant's coming. Okay, we're good now. I was starting to feel better about it. Then another variant.
Okay, I know.
we could be in this a little longer. So I prepared, and I work from home and I've been used to it. It still had its challenges, right? I will say, for me personally, after we talked last, I was going through some just different challenges with, figuring out my career, where I wanted to go next, right?
Right.
And I was feeling a little bit like I have been doing this 20 years almost. At that point, I was almost 20 years. And I felt I needed to figure out what the next step was. And I was a coder working for the hospital. I was also teaching and podcasting. So to me, I had like so many different things going on that my personal life was just non-existent. It just didn't feel like it was even there.
Right.
So I had some conversations with different people, and one in particular who we all know, his name is Jordan Johnson.
Jordan. Yay. That's right. We love Jordan. Yep.
Yes. I call him my male cheerleader. He's just he's one of those people that just is your champion and thinks of you as a champion. And it's always there. He always says, "What's up, coach?" And like, he'll just kind of tell me all these great things. And it's nice to hear, because for so many years, I didn't hear it when I needed it.
Right.
And I needed it at this point. And he explained to me a little bit about my worth and what I needed to do next. And so that was kind of like an obvious, change was I needed to move to the next level. So I made a decision, talked to my husband, decided I needed to move into consulting. And what OncoSpark offered was such a great opportunity to now move into education as a job and like make it my only career, is to be the director of education, because it's my passion.
Wonderful. Wow.
So that's what I've been doing ever since October of last year. I've been the director of education and coding at OncoSpark.
Well, kudos to you and congrats, because you are in an incredible space working with Jordan Johnson. Yeah, we love him and OncoSpark, an incredible organization, and all of the great works that they do there. So my goodness, Jennifer, amazing. Director of Education. That's a title well-deserved. And I know you're putting all of your decades of experience into this new position. So bravo to you. Wow. Incredible stuff, even during a pandemic, right? Anything good can happen. Change can happen. Right. Especially, I've been talking to so many people. It's not always the bad and the ugly during the pandemic, right? There is those shiny, bright spots that happen and career shifts that happened, like for yourself. So yeah, bravo to you. Amazing. All right. Now, you know what? On the flip side, right? We've also been in the PHE, and we've discovered so many struggles and the toll in general that the pandemic has had on so many people. I myself can speak kind of personally, just for 1 second, because my son is a teenager and he does hear my podcast and he hates when I talk about him, but I'm just going to say kids, especially that older teen age group, did really get slammed, especially early on in the pandemic, early in 2020. A lot of these high school kids were sort of in a predicament. They weren't used to doing education on Zoom. And so they were kind of just let go, right? And they could just do Zoom school in their rooms as teenagers. Do they really attend, right? All of those types of issues had come up for him early on. So I know there's many of our youngsters and our youth that were affected. So I can talk about that personally, but I want to hear kind of what you have to say. And in all the people in your life that you encounter, from work to personal, what sorts of issues have you come across, especially with your providers in the mental health care space during the PHE?
Well, I will say, before the pandemic, mental health has always been a thing, and I never personally experienced it until of course, I had someone in my family who I married into the family. And so then that was like my first real experience with anything mental health related. And so I feel kind of ashamed in some ways when I look back at my view of mental health at that point, because I didn't get it. And I didn't understand why this person couldn't just get out of bed, or why they couldn't just get on with their life. And that was in my head. I couldn't figure it out. And it wasn't until I experienced it personally that it really clicked, and I understood what the body goes through. And that was before the pandemic. That was just in a workplace situation where I was always had a manager before, and they took the brunt of that, that maybe we call workplace bullying, or maybe it's just your personality and you express yourself in that way. Right. And you don't realize how it's affecting that person in the workplace. But I never got that, because the managers always took that, right? Like they always took that.
They are the front line. Right. Exactly.
Right. So then I was put into a position where I was in that role, and now I'm experiencing that, and my body's like, what is happening?
Yeah. Right. Oh, wow. Yeah.
What are you going through? And so I think people don't really want to talk about it because they wouldn't want to be vulnerable, especially in a place of authority or in a professional space. You don't want to fall apart and have this embarrassing moment. And I'm going to tell you, I had one of those in my career. I had an embarrassing moment where I broke down in a meeting because I was the end of my rope, and my body just had to react. And I learned a lot from that experience, that was before the pandemic. And I want to tell people out there, if you're experiencing those things now even more, there are things you can do to get yourself on the other side of that.
Amazing. Yeah. You know what? I agree with you. Before the pandemic, in my opinion and in my experience, I agree that mental health issues, whether it's anxiety or stress or you're super nervous, whatever those issues were pre-pandemic, you're absolutely right. It was taboo, right? In our culture, in America specifically, it was taboo to talk about mental health. Like, it really wasn't considered health. Like, who is supposed to care about your mind and spirit, right? It was always about the body. That was always much more valued in terms of quote unquote healthcare, right? That was allowed to be discussed. You were allowed to talk about your lipid levels and if you have cancer and whatever. All of that was much more acceptable to speak about. But when you simply can't get out of bed, you're having a really gray day, no one wants to hear about that pre-pandemic. So I agree with you. Yeah, I've encountered many situations in my life where people are affected with mental health disease. And it is a matter of having that kind of empathy, right, towards that person. And I do believe that the pandemic, one really good thing that came out of the pandemic is conversations, multiple conversations across all the different cultures in the US, right? We're able to now speak openly about what's going on in our personal life, how the pandemic has affected us, that we need an hour off in a day so we can decompress, because there was a lot of that Zoom fatigue as well, right? Yes. Early on, like you and I are on Zoom right now. But I remember early on in the pandemic, we were like, oh my God, I'm so tired of this Zoom and seeing all my work people on the Zoom, being on the camera, right? That also affected many women across the country. That was a big conversation in 2020 at the end of it, that so many people were getting cosmetic work done because they're looking at themselves in the camera every day, all day for business, right? So there was that whole issue. So I think the pandemic really did allow for these greater conversations that were well needed, decades before, but are now finally coming front and center. So I think it's one really, really good thing that did come out of the pandemic are these conversations.
I 100% agree. And, I talked to different people that have experienced things in their personal life and that have affected their professional life. And the same has been true of me, and then vice versa too. Some of the things that happen in my professional life affect my personal life. So it can happen, but we have to learn how to deal with that because we are professionals, right? And we have to understand that what happens in our personal life can affect our professional life unless we're dealing with it. And we can't let the two intersect and affect how each of them are to be conducted. So our families can be healthy, and then our work relationships and the actual work that we do can be healthy.
Absolutely. It's all about mental health and how to have those conversations. I agree. And we have to be able to kind of merge the two together, but also be allowed to separate them for our own well-being.
Right.
I couldn't agree with you more. So, yeah. So why don't we move on here to my next question? I know the second one was kind of a broad question, but let's try and congratulate you, Jennifer, because your podcast, Life as a Coder podcast, first of all, is incredible. week after week. But right now, you're planning on placing a spotlight on mental health. Go figure. And of course, I had to bring you on because once I found out you were doing a spotlight on it, I had to have that conversation with you here. So on your Life as a Coder podcast, you're going to be spotlighting several episodes on mental health, right? I'm so excited. It's going to be great. So when it comes to medical coding, let's talk about that. With the COVID-19 virus, right? That's allowed for the expansion of our very favorite telehealth and telemedicine services, finally. Our behavioral health specialists, right, before that have been kind of in a tizzy. What do they do, right? And so with so many of these relaxations that we still have currently, as we're recording today, those relaxations with CMS and so many commercial payers that are adopting those new billing protocols for telehealth claims as well, right? There have been a lot of providers reaching out for our help, my help, your help, consultants' help, right? So I'd love to know and hear more about what you've been seeing, right? What have you identified as some of those main, big, major, juicy compliance issues during the PHE years?
Well, I will say kudos to all of you out there trying to keep up with all the changes. It's been rough.
It's been rough on us, yes.
Even for us consultants who have been doing this a long time, and those, who worked in behavioral health a long time, you've seen the changes just before the pandemic in general, right? What we considered telehealth services, how we had to document, how we had to interpret payer guidelines was different, right? And then comes in the guidelines, during the PHE, what Medicare would allow as far as audio and visual. And we had to know what kind of equipment we had to have. And, our specialty came into play. We had to understand our specialty. There is, a certain type, there's different types of services are provided in behavioral health. So I will say like the behavioral assessment intervention services, like we have to know the services themselves as a auditor, a coder, a manager, whatever role we are, we just understand the services we offer, and we have to know each payer. Unfortunately, it's a maze.
It is, and they're all different. Right? They're all different.
They're all different, and so there's not an easy answer for any of this. There never is. Our jobs are not just cut and dry. Like we're going to sit down and code, and we're going to enter the charges. Like that's not what
that's not our day to day.
No,
our day to day is a jumble. Right.
At least it's not my day to day. I mean, never was for me, because I want to know every piece of it. I want to know what I'm doing and how it's affecting another department. And I think that's where we get the disconnect is, providers for the most part want to know, or our physicians, they want to know how what they're doing is affecting their bottom line. Yes. And then for those that do want to converse with their coders, those that respect their coders and respect those in the business side, when you have those adult conversations and you can actually come together and work together, that's where the great thing can happen. And in what I've seen, there are some disconnects. And so I will say, first of all, respecting the people that are there in your clinic or your facility that know this stuff. I like to say, stay in your lane, but also communication. The lack of communication with any specialty has been an issue, which we know the pandemic has kind of limited how we can communicate. But do we have ways around that now? Yes, we do. We have ways to communicate digitally and in ways that are effective and HIPAA compliant if we're using those right. So that's the first thing I'll say is communication is a big deal, first of all. And then, of course, the documentation. I did a poll recently on LinkedIn. I was asking people, what is your biggest challenge when it comes to the reimbursement or retention of revenue? And I mentioned, of course, documentation. I mentioned telehealth, and I mentioned, of course, Incident 2, which is what I wanted to talk about next.
Nice.
And so Incident 2, for instance, is an issue because of the remote aspect. So you may have a provider that maybe is ill, but they can still supervise and they can maybe still see a patient, right? They're at home. They're not able to see the patient, but so got to look at your guidelines. What is the payer? How do they interpret this scenario? Because you have all these scenarios. Maybe the patient's coming to the office, but the provider's not there. They're virtual. Right. Or maybe the provider's there, the patient's virtual. So you have these different things that happen. how do you interpret that from the insurance payer's guidelines? You have to get out the policy and read it.
Exactly. And it's the PHE. So even all of the payers changed, right? They changed, they updated all the time. So absolutely, depending on that date of service, when the doctor was at home and the patient was in the office, we have to be mindful of what those payer policies had stated. Yep.
Yes. And currently, the information we have, you have to keep up with the current understanding, because you may be reading an article or guidance from like a year ago, but there may have been updates, the final rules update.
Yes, the final rule updates, right? Exactly.
So you have to know currently, let's just take CMS, for instance. Currently, do you know how they interpret incident 2? Like, do they allow certain types of technology, and do they allow this to be done remotely, and how do they interpret that? So, I'm not here to say specific scenarios, because that's impossible. If I don't see the documentation, I can't tell you. So I never do that on a live broadcast. I never give you specifics, but I'm going to encourage you. And of course, Sonal will, of course, have stuff in her show notes for things for you to look at. But I think it's important to be a good researcher.
Exactly. Yes.
Today, I'm coding this, and I have to know it's Medicare, or it's Blue Cross Blue Shield of my state, or it's United Healthcare, or it's Medicaid of my state.
Right.
How do they interpret this particular scenario? Is what advice. I go through.
Yep. Exactly. Perfect advice.
And then we come to modifiers. And so that is I love modifiers, and I love how they kind of make things that are challenging maybe a little more, you can interpret it easier. For me anyway, like I personally feel like modifiers are awesome. There are things that can alter a procedure and kind of make sense to an insurance payer, because they're not in the room, they're not in the surgery. If something goes wrong, or if something is different than the norm, it tells that extension of the story, so to speak. So you need them. And in 2022, we did have some updates. Now, we always have to keep up on the payer's continued guidance. And when a new modifier comes out, like the 93, allowing for telehealth using audio only communication, how does that interpret, and when can we officially start using it on a claim? Like, those are all the questions we have. So we can't just sit back and wait for the claim to pay. We have to know when we can use it, and how to maneuver through the guidelines, maneuver through these new things, and when to use them.
That's perfect, because you know what, some of these new modifiers for telehealth, for the phone calls, it's also for tracking purposes, right? It just helps the payer track how many of these services are actually being done. And you're absolutely right. The Medicare is only going to start using that, I believe it's in April, but you should be mindful and look at your payer policies for Blue Cross Blue Shield in Connecticut. What are they saying? Do they want to start using that, or do they not want to use it at all, or use something in its place? So yeah, I think one other overarching theme here is pay attention to your payer policies in this podcast, right? So not only is it about behavioral health, we're also saying you should be extra mindful and do all of your due diligence and research current payer policies that are in your payer matrix, for sure.
Absolutely. And I like to get organized too. Not everyone likes spreadsheets. I know not everyone likes binders, but for those of you who can in some way find an organizational tool for yourself to say, okay, like I'm going to put a folder here for all of my Blue Cross information, or United Healthcare or Medicare. And then I know these services, okay, the final rule says until this point, at least, these services are going to be covered for this, for audio, or this is going to be audiovisual, incident 2 guidelines for these services. So you need to know that guideline, and of course know when it ends. But then the other thing is the time, and time documentation has been kind of a taboo thing, because we thought about it mostly with E&M, but there are a lot of procedures that are time-based.
For sure.
So if you work in that field and you do those regularly, you know this. You know that there are procedures that are time-based. So why wouldn't documentation of time be necessary? So that is, to me, like a red flag. If I don't see time documented, and it's a time-based procedure or service, there's a problem because I can't code this or report this accurately.
Absolutely. Right. And speaking about that time-based coding, right? So many EMR systems I find are not correctly set up to begin with, right? Those EMR templates, when you first start those types of services at your practice, the EMR has to be set up correctly so that your notes do capture, start time and stop time. I always recommend, if it's a time-based code, it's very easy to plug in to an EMR what the start time of the service is. Like, when did you have the patient come in and lay on your sofa? It was at 10:07. Just capture that documentation for 10:07. And they did end up staying, for that full 55-minute visit, however they were scheduled. So then you can capture that ending time as well. So in any post-payment audit situation, that documentation can be defended if that needs to be done, because that time is captured compliantly, start time, end time.
I 100% agree.
Yeah.
Absolutely. And I will say, this because, you posted many things that I love about the year of the audit. And
it's the year of the audit. It's the year of the audit. Yes.
It is. So, and at Uncle's we know, like, we've had so many audits and requests for audits because, one of the things I really drilled down this year and last year is the data. As a coder and a biller and an auditor, that's what we do. We look at data all day long, and we learn how to make it relational to our providers. They can look at numbers all day long, but what does it mean? Right. What is the data? What does the numbers mean to you? And I understand in this specialty specifically, it's not a high revenue specialty.
Right.
So you're not going to bring in hundreds and thousands of dollars like you maybe would in a surgical practice where you're high level surgeries, right? But what if you got audited, and what if you were asked to take back all of the money that you did get, or give that back? Or what if someone reported you and you're now going to court? Can you defend that? And how much money are you going to have to shell out to a lawyer or to this process for somebody that could have been fixed for a relatively smaller amount than what you're paying now?
That's right. Thank you. That's what I say all the time, is that proactive, that front work to begin compliance is the way to go. That's my opinion, because I've seen the huge downfalls on the back end on those post-payment audits, where you're right, it's so much money that that provider has to pay back, whether it's in the overpayment clawbacks, whether it's in retaining good legal counsel. All of that costs a lot of money. And then people like you and I that might have to come in and do some consulting and the coding checkups here and there, all of that costs as well. So I always recommend to providers to develop their compliance programs right at the start, right at the start of practicing. So then they're much better protected in the long run, and they can have a better feel that they can keep those monies in the end, so in 5 to 7 years, they're not going to receive a post-payment audit necessarily, right? An audit from a government payer is still a good thing because they're simply reviewing and protecting the Medicare trust fund. It won't necessarily end up in a clawback type of situation if your documentation is compliant already. So then it's just a checkup, right? It's like a checkup going to your preventive care doctor. So it's just a normal audit. It doesn't have to have, a smattering of findings that are very bad looking. So yeah.
Absolutely. And I'll be talking about that, of course, when it comes to mental health, some of those things in the upcoming podcast series.
In your podcast. Okay.
Yeah. So I think it's important to have those conversations on all levels. Like these are the services, but also from a medical necessity standpoint, how do we understand that part, all the pieces that come together, and then how can you understand the specialty that we're working in. Now, I know it's expensive to bring in an auditor, but maybe you don't do it as regular. Maybe you do it once a year, or you do it quarterly because you want to have that looked at. And then in that audit, do you also provide some education? And then is your staff, are they actually following through with that education that you just paid for?
Right.
to prevent these mistakes from continuing, because then you don't have to have regular audits as often if they're following through. So in 6 months or so, you come back and you can see results and you can see they're following through with that. And that's a good thing. And then when we can come back in a year from now, we're good. Kind of check us in a year from now. And those things can help your practice if you have them done, be that proactive external audit, those are great for that purpose. So you don't get those government audits. And if you do, then at least you can pass them.
Exactly. That's exactly correct. That's exactly correct. I understand that compliance can be a financial restraint, right? But absolutely, it can be worked out. It can be a compliance audit annually, right? Semi-annually. However, it is most cost effective to the provider. But the key is to develop that, like you were saying, that trust, that bond between the auditor, the coder, and the provider. That is the key, right? Is to make them understand that we're on their team, we're on their side. We're all about defending our providers and protecting them. So Absolutely. Yeah, that has to be a message that they receive loud and clear. Yeah.
100%.
Yeah.
Absolutely.
Awesome, Jennifer. Love it. So now I think we have another topic that you wanted to perhaps touch on for my audience on risk adjustment, right? Those types of codes for our mental health, behavioral health space. I'd like to hear a little bit more on what you would recommend for our coders, auditors, and our providers when it comes to that type of ICD-10-CM coding.
Well, I would say for the providers, we don't want to kind of change what you're used to. You're the clinician, your craft. And when you see a patient, what's affecting them. So just tell us the story in the best way possible, because I'm sure as a provider, that what you document affects the patient when they see another provider. So it's all kind of a trickle effect, and most providers know that. So it's about us as coders taking the documentation we do get and translating that into coding terms. We didn't go to medical school, but we know some things that we've learned over the years or that we've researched. And so we can learn how to take that knowledge and translate it into what our books say. And we can even show our providers,
right.
I see this in the documentation. I just need a little clarification. In my book here, it's leading me to this conclusion. Do you agree with this? And so I'm not telling my provider this is wrong, you shouldn't do this, say this instead. Like I'm having them lead me. Am I right here in making this conclusion? Because I want you to tell me as the provider, clinician, that I'm on the right track. And that's what I need for my job. And then you have, the coders understanding your role and the guidelines that we have to live within and being proactive. If you see a problem and there's consistent lack of documentation, they're ordering this service and they don't have the LCD policy, the local coverage determination is not being followed, then print it out for the provider, that physician, show them when you order this procedure, Medicare says that these are the particular conditions that they will consider covered. Otherwise, we have to let the patient know that they may need to pay for this because their insurance just won't cover it for this condition. They can still have the service, but just make them aware of it.
Right.
So those are the things. And on the risk adjustment side, if you're in that field specifically, how important it is to capture those items, whether it's, at that point in time, or if it's on a recovery audit, or if it's, you're doing a retrospective or prospective audit, what you're doing and what data is important to you. But there is the social determinants of health, and they have been in our books for quite some time. They have. And so now in recent years, we have in the actual guidelines now, in the ICD-10 guidelines, you can pull that information in from the patient. The patient can say, I'm suffering from this. I have this social issue that happened to me, or this happened in my marriage, or, I was overseas, and, doing this, and then I came home and I'm experiencing these things. There's an issue that covers so many things, and learning to pull those things out. But then you have the medication factor. I'm on this medication and I have to be because I have this chronic condition. But then what social factors, is there an economic factor?
Right.
I need this medication,
right.
but I'm I'm having a financial issue that I can't get my medication. So what's that doing to my health? All of these things come into play. But for me personally, suffering from a personality disorder, from someone who displayed a personality disorder and then having anxiety from that, I've learned in the coding world how that affects things. It affects what the insurance payer knows about you now. They know now you need this medication because we've documented for so much time now these conditions you have. So we know that when they request this medication, we know why. And we know how many resources you're going to consume now. And we're going to be able to budget that into our plan. And so that's what it's about, is understanding that. And then of course on E&M, we know E&M was changed and it's in the moderate level in the risk. So it affects so many levels when we document these things.
So many good points, Jennifer. Amazing. My audience is going to love our conversation today. I'm so happy. I'm so happy. Now, I know it's almost time for you to go. I want to include in my show notes, if you have any resources you can provide, I would love to know where people can go for mental health crisis, if they're happening to encounter them, any good behavioral health resources for our own colleagues, to help them understand any types of great new websites that we should be aware of. So I'd love to get some details.
Absolutely. I will definitely send those over to you, because in my own research for my podcast, I've learned a lot myself about what programs are out there in each community. And there is an actual site for the social determinants of health. And that's where I get a lot of my information specifically about it, what it is, what are the factors. And then in your own community, they have programs that they've developed for these things, the social factors that are affecting people's health. And it's not just from a coding standpoint. It's just for society. We need to understand it to help each other. But then of course, providers, we know providers use the DSM-5. That is the statistical manual for those, for the mental health disorders. That's what they use. And if you're in mental health, you know about this manual because you use it along with your ICD-10 manual to understand the disease process. And then when you're coding it, those things. So those are some of the resources, if you're in mental health, you have to have.
Wonderful.
So I will, of course, definitely send you all of my tips and my references.
Thank you so much. No, I know I'm going to use them every day. So wonderful. Thank you very, very much. Now, before you go, is there anything else that we have not touched on today that you wanted to make sure my audience leaves with your wise words? Anything that we haven't touched?
I wanted to point out too, because early on you mentioned the children and how they're suffering, and it just kind of came to my mind. And because I have nieces and nephews who were affected, and some actually got COVID, and it just broke my heart when my little niece got COVID, and it just broke my heart. And she's a sweet girl, but she's quiet, and I want to make sure that those children out there get the help they need. And our Pediatric Summit that we're putting on in April is virtual, and I wanted to kind of shout that out because it's about the children. And we will have a special speaker at that conference, Barbara Shaw, talking about risk adjustment and the risk that children are experiencing and the diseases that they have that are unique to them. And I wanted to shout that out because there are some mental conditions and other conditions that affect children. We have to help our children. We have to help them get through this pandemic so they can see this world out there that maybe they're just experiencing for the first time in the last 2 years. We want them to not remember this part of their lives as something negative, but and we want them to experience life in a positive way, help them get what they need to get through this. And I think that's important.
Beautifully said, Jennifer. Beautifully said. So I'm going to make sure I include in my show notes the fact that your Ozark Coding Institute is putting on this Pediatric Summit in April. So
yes,
perfect. Thank you so much for being here with me today. I loved our conversation together. It was much, much needed. So thank you.
Well, thank you for having me. It's been a pleasure.
Thanks, Jennifer. I'll see you next time. And now it's time for my best practice tips in Trusty Tip. Of course, to piggyback off of this wonderful spotlight on behavioral health with my friend Jen, it's so timely that there is ironically a new TPE audit, or Targeted Probe and Educate audit, being conducted by First Coast Service Options for Medicare, Part B. So even though this TPE is for the Medicare Administrative Contractor, the MAC, for First Coast, I think these requirements they're looking for are really pertinent to all applicable providers in the behavioral healthcare space who render these types of psychotherapy services. Now, on their webpage, First Coast outlines a checklist for psychotherapy services documentation. Now, this checklist is intended to provide healthcare providers with a reference for use when responding to medical documentation requests for psychotherapy services. Healthcare providers retain the responsibility to submit complete and accurate documentation. Now, as a consultant, I always advise my psychotherapy providers, if they're first starting out, these types of documentation requirements are a must to capture on electronic documentation, paper documentation, hybrid documentation, whatever it may be. Now, this checklist starts with documentation is for the correct beneficiary. Now, that seems to be a no-brainer, right? But I've seen many, many mistakes and errors over the years where the correct patient is not identified properly in documentation. Each and every page should identify the patient's name. Make sure you're doing that. Then, second, they go on and state the documentation should contain a valid and legible signature. I've seen that mistake many, many a time. So the rendering provider, when closing off on the electronic signature, should always be closing that note with a legible signature and date stamp, right? So that should be contained in the EMR system that's being set up. And that's what I mean by a date stamp. I don't mean that date stamp with the rubber stamp on a piece of paper. I mean the electronic date stamp along with the electronic signature. Now, documentation third should also clearly identify the person performing the service, including their title, their education background, and their credentials. The documentation should also clearly demonstrate the session start and stop times. Remember, I alluded to that, or maybe I said that very clearly in my interview with Jen, right? I recommended always best compliance tips are always to capture start and stop times for a psychotherapy session, as well as writing in general a total time as well. That's always good. Then, documentation should demonstrate the type of the service being provided, including the therapeutic techniques that were used and the therapeutic approaches, the modalities, and the frequencies of treatment that's furnished. Documentation should also support, of course, the medical necessity for psychotherapy treatment, which should include the results of any clinical tests, of course, the medication prescriptions and the monitoring of those meds, as well as the summary of diagnoses, functional status, the treatment plan, the symptoms, the prognosis progress, and progress to date. So remember, it's always great to keep that treatment plan separate and distinct. When auditors from the payer side go in, they should be able to identify a clear treatment plan for these patients. You can also supplement the treatment goals, etc., within progress notes, but it's best because auditors on the payer side, especially as First Coast is clearly outlining here in this TPE that treatment plans are a must. Now, moving on, they also go on and state the documentation to support Incident 2 guidelines, if those are applicable. You should be mindful and include evidence of the billing provider's supervision and ongoing participation in the patient's care. And then for services that include an evaluation and management component and E&M component, those E&M services should be documented. And then finally, if applicable and required, the submitted documentation should also include an ABN, right? A beneficiary's waiver of liability. Now, that's huge, right? Their checklist is simply tremendous. 2022, once again, as Jen and I laughed about in the interview, it is the year of the audit. And here we are with another big one that's rolling in for First Coast. I think it's so very important to stay up to date on documentation review before submitting claims. That's the proactive stance I continue taking to help providers avoid simply reacting and not understanding the why when those post-payment audits come in 2 to 4 years, whatever the time frame may be. It's fundamental if you have Medicare as a payer to keep your eye on correct and compliant coding and billing practices, and of course, documentation requirements to help support and insist upon the medical necessity, right? And please make sure you're adhering to all of them from the very start. Because when the documentation paints the medical picture with clarity and vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, I focus Season 5 Spark on clarity and focus. I want this 5th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for clarity and focus in all that we do. So, in this week's inspiring quote in Spark is from our American actress Angelica Huston. Beautiful things comfort. They bring a real clarity and ease. We have to continue to make our environments beautiful. It's sort of like a prayer. If you surround yourself with beautiful things, you have a better life, one with more oxygen. Absolutely true, right? I think this is a perfect quote that reflects on today's greater themed conversation, right? On supporting and embracing our mental health. This quote reminds us that whatever we see as beautiful helps us gain clarity on our lives. Beauty may lie on the baseball fields watching our kids play ball, or on the art that hangs in the art galleries, or in the ocean waves that touch our toes. This selective focus on the beautiful things, the beautiful moments in life, help us to better achieve mental health, great mental health. Now, by prioritizing ourselves, we can give more of ourselves to others without sacrificing our own well-beings. I'm so happy Angelica Huston's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue having an amazing week ahead, and please stay safe and healthy. Thank you so much for listening in on today's very special episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.